Hi everybody, we're going to do a fascia iliaca block and we're going to show you our new fascia iliaca block packs that we have set up that are available in the ED. We're going to show you what's in them and then we're going to go through the setup and how you do them, okay, in a standardised fashion, okay. So this is the pack, okay. So everything that you need should be in here. So if we open this up, so we've got some gloves in different sizes, so use those. This is the cover for the ultrasound probe, just a bag, for the patient. There's the drape, there's the dressing pack that we use, some dressings, and then needle, cleat, and syringes. So we'll set everything up. Okay, and then you'll also need your drugs, okay, and we'll talk about the doses of those later, but we're using Kyrocaine or levobupivacaine, and the standard is 25 milligrams in 10 mils, 2.5 milligrams per mil, or that's 0.25%, okay? Alright, so I've set out the dressing pack here, and that gives you a clean surface to put everything on. Alright, the first thing that we'll open is for cleaning the floral pack. We'll open that up. Okay, so then for your drug you're going to use you're going to need a flush, which I'll show you later. Okay. And then you'll need two 20 ml syringes. So open them. 1, 2, and that's because you're going to need two 20 ml syringes with drugs. Your probe cover for the ultrasound probe. I'll show you how to put that on. And then your sterile gloves. And the needle, okay? So we use the Visoplex needles that are available in the pack. If you can't find the pack, they're also in the clean storage room. The needle here, drawing up the drugs. So this patient has a right neck femur fracture, okay? So we put the ultrasound probe on the opposite side of the hip that's very affected. So if we are, and that just helps so we can look at the ultrasound when we're doing our block, okay? So we keep our ultrasound opposite us, and you're using the linear probe. So you can select your probe on the machine, change to the linear probe, and if you use a nerve setting, it's easier to see the nerve. I'm using my linear probe. This is the probe marker here, and I'm going to keep that towards me, to where I'm going to be putting the needle in, okay? And we're going to use a in-plane approach to putting in the block. Okay, so we're all set up, ready to go. I now have my sterile gloves on. Before I did this, I would have taken a look at the anatomy, ultrasounded the patient to see where I'm going to, what approach I'm going to use, okay? So we've drawn up our 30 mils of Kyrocaine or levobupivacaine in these probes. So what I'm going to do is, this is my needle, I'm going to flush the needle with some normal saline, and so that means that I'm not using any local, that with no dead space. So we'll just flush that. So that's, the needle is all flushed and prepped, okay? So we're going to start off by cleaning. So we're going to clean. If you clean in a circular motion, starting in the middle and move out, circular. Okay. Put down our drape. All set up and clean. Okay, now I'm going to need my assistant. Okay, so this is your ultrasound probe cover. It comes with 2 elastic bands and your sterile gel. Okay, if you get someone to hold your ultrasound probe, okay, and you want to put your probe in the middle here, okay, so that needs to pop down inside. So if you can pop it all the way down inside, that's it. Grab it, and then you can pull this end here. Just pull the end. So that's it perfectly. So now you've got left with some small amount of gel on the top of your probe here, and just put the elastic bands around the top, and that keeps your gel on. And then you can put some extra sterile gel on the top. Okay, so this is the approach that you're going to use, okay? We're going to what's called an in-plane approach. So you want your ultrasound probe perpendicular to the patient's skin, just below the inguinal crease. And what you're looking for on the screen is you're looking for the blood vessels, which you can see as the hypoechoic areas here. Just lost some contact there, and then the hyperechoic area, which is our femoral nerve. And we'll point them out to you on the screen. Okay, so you have identified your blood vessels, you've identified the nerve, and what you want to do then is move the probe laterally. Okay, so now we still have the femoral nerve in view on the screen. So we still have the femoral nerve visible on the screen, and above that is the fascia iliacus. Okay, so the fascia iliacus runs above the iliacus muscle, so what you're aiming for is to inject just below the hyperechoic line, which is the fascia iliaca. Okay, so with the setup with the ultrasound probe, it's important that you have your probe perpendicular, so the tail of the probe is facing up. You also have your thumb and your index finger in the shoulders of the probe, or the little indentation, and then you want to anchor your hand on the patient, okay, and that just helps you not move during the procedure, because your hand will get tired. You get the bevel of your needle facing up. You just come a couple of centimeters just away from the probe, and you're going to angle at about 45 degrees, and then you're going to go right in the center of the probe, because you have to make sure that you're right in the middle of the ultrasound probe, and then you're going to be looking at the screen as you advance the needle slowly, and you should feel 2 pops. You'll feel the initial pop of the fascia lata, and then you'll feel the pop of the fascia iliaca, and then you can inject a small amount of fluid and make sure you're in the right spot, so you can move forward and then see your needle as you advance all the way. Okay, so we're going to use an in-plane approach, so you can see our needle going under the ultrasound probe there. This mannequin is a little bit artificial in that it's deeper than it would be in real life. So you'd usually use that shallower approach with the needle here, but we need to change our angle and go down deeper because of the screen. We're going through the fascia lata now, and then we'll just go below the fascia iliaca, and then we'll inject some small amount of fluid. You can see the fluid. Inject some more. You can see the fluid just in a patient that would be far more clear, the fluid injected into that. Okay, afterwards we're going to get you to put a bandage over the area, and it serves 2 purposes. It's just like a plaster over what you've done, and if you write on the dose, the time, and the amount of drug that you've given. So say in this patient we gave 30 mils of levobupivacaine at 10 a.m. on the 6th of May, and we'll then put that on her leg at the affected site, and that will stop if the patient goes up to theatre or someone gives another block, just so they don't give the extra amount of local anaesthetic and cause local anaesthetic toxicity. Okay, so afterwards it's very important that you clean the machine, okay? And so we're using these wipes, especially for the ultrasound machine, if you could take a look at those. And we use those, not the other wipes that can damage the crystals in the probe, okay? So just clean down your probe, and then we clean down the machine also, okay? It's touch screen, you can clean the machine down.